Topic: Chikungunya Viral Disease. Student name: Roland Mogugu. Detailed overview. Introduction. Question 1A, 1B, 2, question 3A, 3B, and question 4A, 4B. I will be reading out these questions as I go. Introduction. Chikungunya virus outbreak originated in African country of Tanzania in 1952. Identified as a viral infection transmitted to human by infected female mosquito through bite. Chikungunya labeled as a single-stranded positive RNA virus and an alphavirus genus, a family of Togolviridae. Between 1952 and 1953, 23% of infection rate reported and infection prevalence extended from Africa, Asia, and more than 2 million infections were recorded. Chikungunya fever outbreak was recently reported in December 2013 in French sector Saint-Martin, then spread all the way to the Caribbean islands and South Americas. By July 11, 2014, about 355,000 cases reported from 20 countries around the continent of Americas. Within the same year, 2014, 232 cases of chikungunya were reported within the United States. According to the CDC image, this image reflects a picture of Aedes mosquito transmitted chikungunya virus to people. This type of mosquito are found through much of the world. Question 1A. How has this disease been understood? In Tanzania, Mokonde dialect, chikungunya stands for a disease that bent up the joint. Chikungunya virus disease, or known as Chik virus, I will be calling it Chik virus, reflects what was known to be an acute febrile disease, which means disease appear with fever primarily. It also includes joint pain, which can persist for a long period of time. Chik virus incubation period after exposure or transmission starts between 1 to 12 days, followed by symptoms. Symptoms could persist between 4 and 7 days with very severe rashes, but could go away. In addition, other symptoms include muscle pain, headache, nausea, and fatigue. The fatality ratio of the infection is about 1 per every 1,000 of person infected with the virus, means that death rate is very low. Question 1B. What have people thought caused the disease? How did they come to that conclusion? And how has that changed or not changed over time? According to CDC, Chik virus has common symptoms with dengue and Zika virus because of the same mosquito that transmit all of them. Chik virus is primarily caused by mosquito and transmitted by mosquito through bite by infected person. A mosquito virus like alphavirus came from a species known as Aedes aegyptus and Aedes albopicus mosquito in 1960. Chik virus presumed to have associated with dengue virus and hemorrhagic fever that spread to other regions of the world. Between 1963 and 1964, Chik virus epidemic swept through eastern coast of India to Sri Lanka, but the virus went away after 1964. Chik virus is different from dengue virus because during 1964 epidemic in India, 275 patients were tested to determine virology. It was found they had similar symptoms like fever, headache, and severe joint pain. Also, the reports and were similar to previously observed Chik virus symptoms like pain in the small joint of the hand, wrist, and feet, and pain was at the knee. Question 2. Has there been any change in the way that this disease has been identified? Have different symptoms been attributed to this disease? Multiple studies show that Chik virus in Asia occur mostly in urban places. Aedes aegypti marked as the vector and male mosquito identified as positive for Chik virus. Over time, there has been no change in the symptoms, but the rate of transmission has shifted between 2004 to 2014. In 2004, there was outbreak in Kenya with about 13,500 cases, and between February to May 2006, Sicily had 800 cases reported. The manner of past spread in couple of years had changed the way of approach and understanding. Chick virus is seen to be common with other invasive Aedes aegypti mosquito. As it mutates, it helps the vector to transmit. Recent studies shine a new light on symptoms such as induced joint swelling on immune-mediated, which involve pro-inflammatory cytokine. There is currently no new symptom discovered for Chick virus, but more studies have found absence of herd immunity related to the virus, which means reinfection may occur in person. How has the disease been treated by the medical community? Study found a widespread of Chick virus local transmission in America, but FDA has yet to give approval for specific treatment. Clinically, there is approved T-cell immunosuppressant drug that have been used for mainly Chick virus-induced musculoskeletal inflammation issues. Drugs such as cyclosporin A and rapamycin both have different chemical makeup but are clinically approved. 3B. What treatment have doctors prescribed, and has this changed in the way ordered over time? The population who are at risk for severe Chick virus include newborns that are infected at birth, adults about 65 years old, and people with compromised health conditions such as high BP, diabetes, and other heart disease. There is no specific remedy or treatment or vaccine for Chick virus, but doctors may prescribe managing of symptoms such as joint pain, which include drink plenty fluid to prevent dehydration and rest, take fever-induced such as Tylenol, avoid aspirin to prevent bleeding, and talk to your doctor if taking other prescribed medication. Preventative measures: avoid living areas that allow mosquito to breed. 4. Has the disease been understood? How has the disease been understood or viewed within society? Society is concerned about possibility of travelers coming back from the infected region with the virus. Studies show that an asymptomatic traveler could count 1 to 14 days if exposed with Chick virus, a period of incubation before experiencing symptoms of the virus. 4B. And has this changed over time? This virus has not changed, but there has been no current epidemic. Although in 2020, the CDC had confirmed cases in some states in the US, these cases did not come from mosquito but travelers visiting the country. There are 18 cases of Chick currently reported, and 18 cases are travelers coming from affected regions. These are the references. I hope you enjoy it.